Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwonka. First, some of the highlights. Today, Governor Fintiri of Adamawa State demands a public apology from the Federal Airport Authority of Nigeria. More than 100 people arrested in Ekiti State as government enforces the use of face masks in the state. And EU leaders agree on a huge economic recovery fund in loans and grants to member states for coronavirus recovery. To begin with figures from last night, the Nigeria Center for Disease Control, NCDC, confirmed 562 new cases and 12 deaths in the country, putting the total confirmed cases at 37,225. 15,333 cases have been discharged and 801 deaths have been recorded in 36 states and the Federal Capital Territory. Of the 562 new cases, they are reported from 20 states and the Federal Capital Territory, with the FCT recording 102 cases, its highest, overtaking Lagos and other states in its daily caseload by 2 cases. Lagos recorded 100 cases, Plateau 52, Kwara 50, Abia 47, Kaduna 35, Benue 34, Oyo 26 cases, Ebonyi 24, Kano 16, Niger 15, Anambra 14, 12 in Gombe, 11 in Edo, 6 in Rivers, Nasarawa recorded 5, Delta 5 as well, Borno 3, of course Enugu recorded 2 cases, so also did Bauchi State and Kebbi 1 case. So far, the number of samples tested nationwide totals 214,228. Bauchi State government says it has run out of reagents for COVID-19 testing, and this is causing bottlenecks in its capacity to carry out more testing. In an interview with our correspondent, the Commissioner of Health, Dr. Ali Maigoro, revealed that the state's financial resources is overstretched as a result of huge sums spent to purchase reagents. He's appealing to the NCDC to come to their aid, since the states sometimes receive samples from neighboring states like Gombe and Plateau.
Just 2-3 days ago, our second laboratory in the state at Abubakar Tafawa Balewa University Teaching Hospital has come on board. So now we have 2 testing laboratories in the state, in addition to the one that was previously launched. So we have a capacity to test up to 500 to 600 samples in a day. But you know, most of this sampling, as we realized recently, there are some challenges. And the challenges of the testing is basically of the reagents. In Bauchi, all the 2 laboratories, they use the real-time PCR machine. So this real-time is very sensitive to some certain reagent, like the live river. But the dungeon is very difficult. It's not that the laboratory scientists cannot do the dungeon, but it's giving them very, result that you need to be retesting over and over again. So we need support from the NCDC in this regard, which we are communicating. So if you can have enough reagent of the live river, which is very expensive, we can be able to scale up most of this testing in the state.
The National Agency for Drug Administration and Control, NAFDAC, says it has arrested 3 persons for allegedly producing fake hand sanitizers in Yobe State. The state coordinator, Mr. Lawan Musa, told Channels Television the suspects were nabbed during its routine surveillance in Damaturu, the state capital. According to him, the 250 hand sanitizers of 100 ml seized has no manufacturer's product label, no address, and no NAFDAC registration number. He says the agency is working tirelessly to ensure that the general public are safe, especially during the COVID-19 pandemic.
Product and sanction the sellers of this particular product. They want to seize the opportunity of the COVID-19 pandemic to make money without considering, without recourse to the danger force to the society. Calling on the general public, whenever they want to buy hand sanitizer or anything for them to use, they have to check the manufacturer name, the manufacturer address, NAFDAC registration number, batch number, production date, best before date. These are requisite features for you to see in a particular product in order to buy, to protect you. With the registration of NAFDAC, you are covered.
Following the economic effect the coronavirus has created around the world, states in Nigeria are adjusting their 2020 budgets in line with the economic realities. In Ebonyi State, the governor, Mr. David Umahi, has signed the 2020 revised budget into law. A virtual signing performed at the Ecumenical Center, Abakaliki, the Ebonyi State capital. The governor, while signing the budget, says that the state government is focusing more on agriculture and other selected projects to inject funds into the economy to recover from the COVID-19 pandemic. He also noted that the 2020 budget initially approved was cut down. Now, over in Ekiti State, the government is going tough in enforcing the use of face masks by residents amidst the rise in cases of the coronavirus. Our correspondent reports that more than 100 people have been arrested in the state capital at the restart of the enforcement. According to Mr. Bolaji Aluko, coordinator of the COVID-19 task force in the state, he says that its role will be felt across Ekiti.
It has always been on, but we now feel it is actually far more important for the citizens of Ekiti to know the seriousness involved in wearing of face masks, and we are now reinforcing that enforcement. And we want that to start today, and it has started fully today. It's the reinforcement of the enforcement. We are not interested in charging people or anything.
So lots of enforcements and different measures states are indeed trying to fight the spread of the pandemic. But let's talk more about a solution, a treatment regimen, or the race for a vaccine. We have Dr. Chizoba Wonodi, Country Director, Johns Hopkins International Vaccine Access Center. She joins us from our Abuja studio. I'd like to thank you for joining us.
For having me. Pleasure.
All right, perhaps let's begin with your thoughts on the past couple of months. Are you seeing any results in some of our interventions to keeping the virus at bay?
Well, I think that, first of all, we've ramped up testing, which is great because you need to know the prevalence or incidence of the infection in the community in order for you to have the right response. So it's great to see that many of the states, or practically all of the states, have testing facilities. But I think what we really need to do is to think about what is our strategy for testing. It's good to ramp it up, but you can agree with me that somebody who is negative today might be positive tomorrow. So if we don't have a good strategy for testing, the information we have from our testing may not be useful. Recently, we heard that I believe the Honorable Minister of External Affairs tested positive after testing negative 4 times. So what we need to do is, as we're doing the testing, we should also be doing behavioral surveillance to know if people are keeping to the behaviors that will prevent COVID-19. And so we know we can really interpret our testing properly. Because if you have people testing negative and they are not protecting themselves, obviously they are going to get infected, quite in the near future. So we need a strategy that combines testing with behavioral surveillance so that we know whether people are adhering to protective behavior or not, and we can interpret our testing much more better.
Following testing, I thought the major news was that we're testing the best way, coronavirus, so to speak, rather than using all of those rapid response tests or RDTs that we haven't validated. So I thought we're testing the best possible way, and this definitely finds out if there is a virus or not.
That is correct. But what I'm saying is this. If, for example, there is a state with what we're doing in testing is we're testing symptomatic people and people who are contacts of confirmed cases, which is the right thing to do. I believe in addition to that, we need to understand what is going on in the community. So we can have some surveillance areas or sentinel surveillance areas where we can test a representative sample of the population to understand what the prevalence is. And at the same time, we are tracking behavior in that representative sample over time. So we will know to what extent the behavioral interventions are having effect in slowing down transmission.
Okay.
Right now, we don't know that. All we know is that the more we test, the more we identify cases. But why is that so? Is it because people are not adhering? Or is it for some other reason? We need much more data, much more strategic data than just the number of people who are tested and who are found positive.
All right, we understand positive news from University of Oxford on the progress made in the development of the COVID-19 vaccine. We also understand that phase 3 trials are needed to validate its efficacy against the virus. But what's your take on that? And, what is supposed to be the make of a vaccine that will work against the coronavirus?
So you're absolutely right. Right now, there are about 160 different vaccine candidates in trial. 26 of them are in human trials. And before a vaccine is put in a population, it goes through the most rigorous level of testing. And that's because vaccines are given to healthy people. So you don't want to give a healthy person, a substance that will make them sick. So vaccines go through very, very rigorous testing. 5 stages, as it were. First of all, they have to be tested in animals to make sure that there's an immune response. And then secondly, it goes into phase 1. It goes into phase 1 trial. In a phase 1 trial, it's just a few healthy individuals who volunteer are tested so that you can ascertain that the vaccine actually has immune response in humans. Then it goes into phase 2 trial where you have hundreds of people, volunteers again, who get tested on the vaccine. And the objective of that is really to make sure that, first of all, there's an immune response, and then there is more about dosing. And at that time, they would also look at different, testing it in different types of people, in children or in the elderly, and so on and so forth. Then it goes into phase 3 trials where you have thousands of people who it's tested on, and then there's a comparison with a population that does not receive the vaccine. So you know how effective it is, or what they call the efficacy of the vaccine. And for COVID vaccine, there's been discussion around how you can fast track that process, but many experts are warning that you cannot fast track the process at the expense of the public's confidence in the safety and efficacy of the vaccine. So those discussions are ongoing. I know that in the US, there's a move to ensure that in phase 3 trials of any vaccine that will be approved, they would have a minimum of 30,000 individuals that have that are part of the trial. So we're happy that there is progress in the vaccines field. You mentioned the Oxford vaccine, which is true. The vaccine has been in phase 2 trial. They found that it actually provokes quite a bit of an immune response. So that's a positive sign. And then what we're now looking forward to is the phase 3 trial, where it will be trialed in thousands of individuals to make sure that it's effective, it's safe, and that it's well tolerated by different populations.
All right. A lot of people are optimistic. In fact, the whole world is. We'd like to thank you, Dr. Chizoba Wonadi, Country Director, Johns Hopkins International Vaccine Access Center. Thank you for joining us on the program.
My pleasure.
We have more on the coronavirus update when we return. Stay with us. Welcome back. Governor Mario Fintiri of Adamawa State has written to the Federal Ministry of Aviation, the Federal Airport Authority, and the Presidential Task Force on COVID-19 to publicly apologize to him for defaming, lying against him, else he may be compelled to take further actions. This disclosure was made by the Director General, Media and Communications to the Governor, Mr. Solomon Kumanga, in an exclusive interview with Channels Television in Yola, the Adamawa State capital. According to the spokesman, he says they have challenged FAN to release the footage of the Governor's arrival at the terminal.
Happened in Port Harcourt to warrant the kind of media hype that followed the claim by the Federal Airports Authority that Governor Ahmadu Umaru Fintiri of Adamawa State flouted COVID-19 protocol. He arrived at the airport, duly presented himself with 5 other people, 4 who were his aides and 1 who was his associate, presented himself for the thermometer screening, also went through, had his hand sanitized, and before he now moved on, and he was in a hurry to go to the meeting of the PDP Edo State Gubernatorial Campaign Council, and so that was why other protocols he didn't go through, and he never showed in any way that he was even a governor, so that he wouldn't draw attention to himself or even prove that he was a VIP. So the whole idea is that the FAN simply maliciously defamed him by saying that he didn't observe any COVID-19 protocol. The truth of the matter is that we have challenged the Federal Airports Authority to release the footages of his arrival at the terminal, where we believe that, of course, every airport should have CCTV cameras. So if it is so, why the delay and why the hurry? That is why we are saying that this is not actually unconnected with politics.
Talking more as to how to flatten the COVID-19 curve, we have in the studio in Lagos a public health physician, Dr. Adewale Agosu. Thank you for joining us on the program.
Thank you, Millicent, for having me.
All right, what's your observation of the virus curve with our daily rates and then where our testing is, a little over 200,000?
Okay, if you plot a graph, like you said, a linear graph, to see the incidence, and for example, in the past few months, you will see that the curve is not coming down; it's going up. Rather, it's going up. That means, despite the new cases, despite the testing, we're still having more people coming up with this virus. So we still have the virus is with us, and we need to keep testing more people. We'll try our best anyways.
Okay, would you say that misinformation is a threat, a major threat to the pandemic fight?
It is a major threat. Honestly, excuse me, for example, I'm sure you saw a viral video that went some few weeks ago that people were saying, do you know somebody that knows somebody that knows somebody that I was just like, oh, in this part of the world, people joke with things a lot. So there's a lot of misconception. Number one, some people don't believe this virus exists. While some people believe, okay, it is there, it's for the rich people. While some people don't want to go to hospitals. They believe if I have malaria, they will just term it as COVID-19. Therefore, they don't want to go to hospital. They end up doing self-medication. So there are a lot of work that still needs to be done concerning misinformation. And the National Orientation Agency, they started doing something about, as of last week or 2 days ago, they've gone into different communities, local governments, to sensitize people. They're going to markets. They're going to tell people about this the virus to make them.
It's really one thing to do all of that, but it's another thing for the people to actually sit down and listen.
Yes.
And then adopt the protocol.
Yeah, adopting, I'm sure the other person, the doctor you interviewed earlier, talked about the behavioral change, the behavior of people adapting to these guidelines, social distancing, wearing of face mask and all. Even if you test and you tell people, but people have to sit down and adhere.
All right, that's on the one hand. The Ministry of Health recently says that patients, and that's those that have COVID-19, shouldn't see it as, or rather see COVID-19 as persecution or punishment. Is there another way to really reassure Nigerians?
Okay, yes. For anyone having COVID-19, I'm sure, in fact, it's said that 81% of people with COVID-19 will recover. So it's not a death sentence. I've had friends that have doctors in the line of duties that contracted this virus and they recovered, even went to isolation centers and came back doing well, you understand? So it's not a death sentence. However, I think what can be done is, for example, the popular musician, P-Square, was on the air and he told people that, okay, I'm COVID-19, yes.
His family
so
as well.
when people like that are influential in society come up, and if you can get people like that to come to your program and tell the whole world that this thing is, I've had it, that they've had it, or had it, and I've gone through it, it's not a death sentence.
All right, we appreciate your time. Thank you so much, Dr. Adewale Agosu, public health physician. Thank you for joining us.
Always my pleasure.
EU leaders have struck a deal on a huge post-coronavirus recovery package following a fourth night of talks. It involves 750 billion euros in grants and loans to counter the impact of the pandemic in the 27-member bloc. The talks saw a split between nations hardest hit by the virus and frugal members who were concerned about costs. It is the biggest joint borrowing ever agreed by the EU. Here's more on our global update.
The European Council President Charles Michel has described the European Union's hard-won deal on a massive recovery plan for its corona-hit economies as a sign that the 27 nations could stand together with a common belief in their future. Michel proposed that within the 750 billion euro recovery fund, 390 billion should be non-repayable grants, down from 500 billion originally proposed, and the rest in repayable loans.
This is a good deal, this is a strong deal, and most importantly, this is the right deal for Europe right now. I would like to thank all the leaders and the President of the Commission and their teams for their hard work. We showed collective responsibility and solidarity, and we show also our belief in our common future. And this agreement sends a concrete signal that Europe is a force for action.
Australia's southeastern state of Victoria, whose capital Melbourne is in partial lockdown amid a new outbreak, reported 374 new COVID-19 cases on Tuesday, up from 275 cases detected a day earlier. The figures dent hopes that Victoria will see a sustained slowdown in COVID-19 cases 2 weeks after nearly 5 million were told to stay home except for essential reasons. Australia's second most populous state also reported 3 deaths from the coronavirus, increasing the national death toll to 126.
Yeah, certainly we're seeing a roller coaster of numbers, and I think to a degree our anxieties do rise and fall as the numbers do. But there has been some levelling in the last 4 or 5 days. I know the day-to-day changes can be substantial, but the modelling of a couple of weeks ago, if we had been on an exponential curve, which is what happens with coronavirus, we would have been at thousands of cases at this point in time, and we're not. We're at 374. I'm not satisfied with that, but it's much better than 3,000.
And as Colombia celebrates Independence Day, the country's confirmed cases topped 200,000, while deaths from the disease reached 6,929, as the Andean country continues a month-long lockdown meant to stem the infections.
That's the COVID-19 update. Thank you for watching. Don't forget our website, channelstv.com, has the latest news and trends. All you need to do is log on, access the news in health, and of course, several news on the coronavirus pandemic on that page, channelstv.com. That's the program. Thank you for watching. I'm Millicent Nwaka.